20 early warning signs that cancer is growing in your body. Before relying on testing for answers, you are already gifted with a natural testing machine, your body. Listening closely to your body can provide you with some helpful hints on spotting diseases, like cancer, that you might otherwise overlook. Early detection is extremely important when it comes to cancer progression, so if you notice any of these early warning signs of cancer, check in with your doctor to see if more tests are required. Early cancer warning signs to look for. 1. Wheezing/shortness of breath. Lung cancer patients remember noticing this as one of their first symptoms but didn't initially connect it to cancer. 2. Frequent fevers or infections. Frequently a sign of leukemia, a cancer of the blood cells that starts in bone marrow. It causes the marrow to produce abnormal white blood cells that hinder your body's infection-fighting abilities. 3. Difficulty swallowing. Most commonly associated with throat cancer, but can be a good indicator of lung cancer too. 4. Weakness and fatigue. Such a common symptom of cancer that it should be looked at in combination with other symptoms to determine which it is. 5. Feeling full and unable to eat. This is a sign of ovarian cancer. A loss of appetite even when you haven't eaten for a while is a tip-off. 6. Anorexia. Could be an early sign of pancreatic cancer. A sudden disgust for coffee, wine, or smoking can be linked to this as well. 7. Rectal bleeding or blood in stool. Common sign of colorectal cancer. Blood in the toilet should be a big enough sign to see a doctor immediately. 8. Lumps in the neck, underarm or groin area. Swollen lymph nodes indicate changes in the lymphatic system which can lead to cancer. 9. Excessive bruising or bleeding that doesn't stop. Suggests abnormalities with the platelets and red blood cells, which can be a sign of leukemia. Leukemia cells crowd out red blood cells, impairing your blood's ability to carry oxygen, leading to clots. 10. Bloating or abdominal weight gain. Ovarian cancer patients reported unexplained bloating that came on suddenly and continued for a significant amount of time. 11. Unexplained weight loss. An early sign of colon and other digestive cancers. Also a sign of cancer that has spread to the liver, affecting your appetite and the body's ability to get rid of waste. 12. A red, sore, or swollen breast. Indicates inflammatory breast cancer. Unexplained changes should be told to a doctor immediately. A nipple that appears flattened, inverted, or turned sideways had also been noticed by patients diagnosed with breast cancer. 13. Swelling of facial features. Lung cancer patients have reported noticing puffiness, swelling or redness of the face. Small cell lung tumors commonly block blood vessels in the chest, preventing blood from flowing freely to the head. 14. Sore/lump on the skin that bleeds, becomes crusty or doesn't heal. Different types of skin cancer, melanoma, basal cell carcinoma and squamous cell carcinoma, can cause these, so be aware of any odd-looking growths or spots. 15. Changes in nails. A brown/black dot under the nail can indicate skin cancer. Pale or white nails can be a sign of liver cancer. Clubbing, which is the enlargement of the fingers with nails that curve down over the tips, can be a sign of lung cancer. 16. Unusually heavy or painful periods, bleeding between periods. A common sign of endometrial or uterine cancer. A transvaginal ultrasound should be considered if the problem persists. 17. Chronic cough or chest pain. Leukemia and lung tumors, among others, show symptoms that can mimic a bad cough or bronchitis. Some patients also reported a chest pain that extended to the shoulder and down their arm. 18. Pelvic/abdominal pain. Pain and cramping in the pelvis can be linked with the bloating signs of ovarian cancer. Leukemia also does this because it enlarges the spleen. 19. Pain in back or lower right side. Often an early sign of liver cancer. Breast cancer can also be found through this, as a breast tumor can press backward into the chest or spread to the spine/ribs. 20. Upset stomach. Stomach cramps or a frequently upset stomach can be a sign of colorectal cancer. If you like the video, give it a thumbs up and share with your friends. For more videos and tips, subscribe to the channel.